The nervous system, third lecture. In the previous two lectures we spoke in a little bit details about the brain. Today also we will continue about the coverings, okay, the brain or of the CNS in general, brain and spinal cord. We will speak about the ventricular system of the brain, and then we will move lastly to the spinal cord. Three main topics or parts in this lecture. Starting with the meninges, or the protective coverings of the central nervous system, brain and spinal cord. These protective coverings, which we refer to them as meninges, the ones that they are the same, the ones, three layers of membranes, ثلاث أغشية, okay, that's covering and protecting the brain and the spinal cord. They are continuous with each other, okay, but the part that's covering the brain, we call it the cranial meninges, and the part that's covering the spinal cord, we call it spinal meninges. Okay, just to distinguish between them, but they are the same membrane all the way around, okay, and they are continuous with each other. Cranial meninges or spinal meninges. What are the meninges? Meninges in Arabic means شو المننجز؟ سحايا بنسميها. Okay, so those are three layers of membranes, three membranous layers. That's completely covering the central nervous system, brain and spinal cord, okay? We call them from outside to inside as the dura mater, which means the faraway mother, al-ummul jafiyah, mater from maternal, okay, umawi, okay, umume, so the dura mater. Then we have the arachnoid, al-ankabutiyya, okay, and lastly, the one which is in close relation to the brain tissue, we call it the paya mater, okay, the close mother, okay, or al-umm al-hanun, okay. So three layers of membranes. Why these membranes are located? They are usually located between the bones of the skull, the cranial bones, and the central nervous system tissue, mainly the brain tissue, okay? So we will concentrate here mainly from now on the cranial meninges, okay? When we speak about them, they are three membranous layers that covering the brain, okay, and separates it from the cranial bones. Why? What are their functions? First, they provide protection, okay? Second, they provide a framework, okay, for what? For arteries and veins that's passing in within them, okay? Especially within the dura layer, okay? The outest or the outermost layer, okay? The dura mater. As you see here, you can see a vein here, okay? So they provide a framework for arteries and veins. Now within the skull, within the cranium bone, you have to know that there are two types of arteries, okay? There are arteries which provide blood supply to the bones of the skull and to the meninges themselves, okay? And we call them meningeal arteries, okay? Meningeal arteries. Those meningeal arteries will pass here, same as with these veins. We call these as venous sinuses. So meningeal arteries pass here, between the dura and the bone, okay? We call them meningeal arteries. The second type of arteries within the skull, we call them cerebral arteries, and you will see them here, between the arachnoid and the pia mater. Those are called cerebral arteries, okay? So, one of the functions of these meninges is that they provide a framework, itar, okay, support, okay, da'im, for these arteries, both meningeal and cerebral arteries. And we'll go in more details as we speak about them. And lastly, they are enclosed a fluid-filled cavity around the brain and the spinal cord, okay? This fluid-filled cavity is filled with a fluid, we refer to it as the cerebrospinal fluid, the fluid around the cerebrum and the spinal cord, okay? The cerebrospinal fluid. This cerebrospinal fluid will actually act as a shock absorber, okay? يمتص الصدمات, okay? So it allows for the brain and the spinal cord to be located within a fluid environment, okay? This fluid environment will act as a shock absorber, okay? So then three membranous layers, okay? Dura mater, you can see it here in brown. In violet, you can see the arachnoid mater, and in light blue, you can see what? The pia mater, okay? Three membranes that's covering the brain. They provide protection, they provide a supporting framework or environment for arteries and veins, and lastly, they have a cavity filled with the fluid. We call this fluid as CSF, cerebrospinal fluid, which helps in what? In acting as a shock absorber, okay? for the brain and the spinal cord. So when we look here now, this is the calvarian bone, okay, or the cranial bones, اللي هم bones of the skull. Let's imagine this would be, for example, a parietal bone, okay. Now, deep to the bone, you will see the three layers. The first layer, which we call it the dura mater, الأم الجافية, okay. This is an exceptional layer. Why? Because this layer is made actually of two parts, as you see. This is the first part, we refer to it here, within the cranial, okay? This is the periosteum. If you study the bone, you will know that the bone is covered by what? By a thin, tough membrane from both sides, okay? We call it peri, means around, osteum bone, periosteum membrane, okay? So the periosteal membrane inside the skull bone, which we call it sometimes endosteal layer, okay? No, we call it periosteal from inside the cranial bone. The periosteal layer, some anatomists, okay, they consider this layer as the external layer of the dura mater. Okay? The deeper layer, which is in brown here now, this is a tough fibrous membrane. غشاء قاسي جدا. If you look to it here, you see it here. This tough membrane, this is the main part of dura mater. And this is which we call it the meningeal layer of the dura. Okay? The meningeal layer of the dura. So remember this, the only exception is dura mater, because sometimes we consider it as two parts. The periosteal layer, okay, which is continuous with the bones, okay, of the skull, and the inner main layer, which we refer to it as the meningeal layer, okay, of dura, which is a tough membrane, okay. Deeper to the dura mater now, you will have another layer here. In this layer, which we call it the arachnoid layer, okay, you will see that it sends several trabeculae. Trabeculae means branches, okay? It sends branches, okay, all the way down to the inner layer. These trabeculae will go and branch, forming as a spider web, مثل شبكة العنكبوت, okay? These spider web structures, so that's why we would refer to this layer as the arachnoid, okay? العنكبوتية, okay? That's why they call it the arachnoid. These trabeculae are very important. Once they are going there, they will allow for a space below the arachnoid here. This space we would refer to it as, شو هذا السبيس بصير اسمه? The sub below arachnoid space. The subarachnoid space. Okay? So now we have the bones of the skull, then we have the dura mater, okay, with two layers, periosteum and meningeal. Close to the dura you will have the arachnoid mater. Below the arachnoid you will have a space filled with the trabeculae from the arachnoid. This space is called the subarachnoid space. This subarachnoid space in normal humans, it's filled with the fluid. Okay? This fluid is the CSF, okay? The cerebrospinal fluid. So the cerebrospinal fluid is located here between the arachnoid and, which layer is this? The pia mater, okay? الأم الحنون, pia mater. So in this space below the arachnoid, which we call it the subarachnoid space, you will have the cerebrospinal fluid. And you will have, as you see also, cerebral arteries, which will provide blood supply, okay, to the brain tissue, okay? Deeper to the subarachnoid space, you will go to the pia mater, okay, which you see it here. This is a very thin membrane. It's very thin, okay, very delicate, okay, and it is firmly attached to the brain tissue. So it follows the brain contours wherever it goes. فلما تطلعوا في السيريبرام مش هو بيعمل elevations و depressions, gyri and sulci. The same the pia. It will follow the contours of the brain. When it goes into a sulcus, it will go there. It goes into a gyrus, it will go there. So it follows the contours of the brain and it is firmly attached to it. Okay? فبالتالي the blood supply تاعها بيختلف عن the blood supply of the remaining parts of the meninges. Okay? The blood supply of the pia mater is actually comes from the cerebral arteries. So if you remember, just few seconds, I said that we have two kinds of arteries. Okay? Arteries located here in the subarachnoid space, we refer to them as cerebral arteries because they provide blood supply to the cerebrum. Okay? To the brain tissue. Okay? Along with the brain tissue, they also provide blood supply to this layer of meninges, which is the pia mater. Okay? In addition now, you have some arteries will be located here, between the two layers of the dura. As you see here, there is a very large vein here. between the meningeal layer and periosteal layer of dura mater. Okay, this is called a venous sinus. Okay, when the vein is large, we call it a sinus. So they are very large in diameter. We call them sinuses, venous sinuses. And when the artery is large, what we call it? Trunk. Okay, we call it a trunk, like the trunk of the tree, which will branch into smaller arteries. So when a large artery is called the trunk, a large vein like this, we would call it a sinus. Okay, you will see around these sinuses also some arteries here. Those arteries we would call them meningeal arteries, and those are the ones which are responsible for providing blood supply to what? To the periosteum and bone, and to the dura itself, to the meningeal layer of dura. So we have meningeal arteries here, and we have cerebral arteries here for pia mater and brain tissue. Meningeal arteries here for bone and dura mater. The only one which will not receive blood supply is this layer, which is the arachnoid matter. Why? Because its oxygenation and nutrition will come usually by filtration from the fluid here, which is the CSF, the cerebrospinal fluid. Okay, so this layer we refer to it usually as avascular. A means without, vascular blood supply. Okay? So, back again, when we speak about the meningeal layer, remember it is an external layer which made up of the periosteum of the bone and internal meningeal layer. This is the main one, the internal meningeal layer. Remember this. In the internal meningeal layer, it's a tough, thick, fibrous membrane. Tough, قاسية جدا, thick, okay, سميك, fibrous, leafy, okay, fibrous membrane, which usually continues at the level of foramen magnum to go into the spinal cord, okay? And this is the only difference between the meninges, the cranial meninges covering the brain, and spinal meninges covering the spinal cord. Because cranial meninges, when you look to them, the dura there is made up of two layers, meningeal layer و periosteal layer. الآن لما ينتهي هذا البريوستيوم بده يكمل حوالين البونز, okay, of the skull. فعلى الفورامين magnum it will reflect and go to cover the bone from outside. هذا البريوستيوم. فما له علاقة بإيش؟ بالمننجيز في السباينال كورد. The meningeal layer only, the brown layer here, which is the one that will continue to cover the spinal cord only. So the dura mater of the spinal cord is made of only one layer. Okay? Is this clear? It's made of one layer, which is this layer. Okay? But the dura mater covering the brain, the cranial dura, is made up of two layers. The periosteum of the cranial bones and the meningeal layer. Okay? But spinal dura is one layer, the meningeal layer only. The brain venous sinuses, as you see here. Venous sinuses means large veins. Okay? These venous sinuses and the meningeal arteries are located between the periosteal layer and meningeal layer of the dura, as you see here. This is one of the large venous sinuses of the brain, which is located between the periosteum and the meningeal layer of dura, okay, of dura mater. Dural reflections, those are important. What we mean by reflection is folding, انطواء, okay? So the meningeal layer only, again, because the periosteal layer is firmly attached to its bones, just around the bone. So the meningeal layer, okay, of dura will fold, تنطوي, okay, to form what? Between the different components of the brain. If you remember, we said that the brain is made up of cerebrum, cerebellum, صح? The cerebrum is two halves, separated by a long fissure, okay? Cerebellum also is two halves, okay? That's separated also by a groove or a fissure, okay? So, what's happening here to prevent, and the brain is located within a fluid environment, the CSF. So it's easily when you have a rotatory movements that the brain can move around, not remaining as it is in position, okay? So we need something to restrict the rotatory movements of the brain, okay? إنه البرين ما يظلش يلف حوالين نفسه, okay? Or يظل يعمل rotations. By this, how to prevent this? By forming these dural reflections. So those are foldings of the internal meningeal layer of a dura, add here of a dura mater, okay? Internal meningeal layers between the brain components. Why? To restrict the rotatory displacements of the brain. This is the function. Okay? So, when you look here, This is the two cerebral hemispheres. The meningeal layer of the dura will reflect down around them and go up again and here. So this is here the area of longitudinal fissure. So this is the folding of the dura here. By this folding, we will prevent these two hemispheres from getting what? A rotatory displacement, okay? From changing their location in a rotational way. Those foldings of the dura, the first one, most important one, is the one within the longitudinal fissure to prevent the rotatory displacement of the cerebrum, okay? So it goes in the longitudinal fissure between the two cerebral hemispheres. So we refer to it, which you see it here, this one. So we refer to this structure as the fox cerebri, okay? Fox is a Latin word, which means sickle shape. Meningeal, okay? Cerebri from cerebrum, المخ, okay? So the fox cerebri is this fold, which you can see it here in this image. This is which we refer to it as the fox cerebri, okay? It's the first folding of a dura, okay, between the two cerebral hemispheres. A similar one located down here, as you see, between the two hemispheres of the cerebellum, okay, a smaller one, very small one. We refer to it as fox cerebelli, okay? Then there will be a folding between cerebellum and cerebrum, okay, horizontal one, okay, cover between the cerebrum and the cerebellum, which is, you see it here. This which we refer to it as the tentorium cerebelli. Tentorium from tent, khaymi, okay, over what? Over the structure here, the cerebellum, tentorium cerebelli, okay? So by this, the dura will reflect to what? To separate between the two cerebral hemispheres, will reflect horizontally between the cerebrum and the cerebellum, okay, back again around the cerebellum, and will reflect between the two cerebellar hemispheres, okay? First folding, fox cerebri, the horizontal one, tentorium cerebelli, and the vertical one back within the two cerebellar hemispheres, we call it fox cerebelli, okay? Those are the main dural reflections. A smaller one, you will see it down in the base of the skull. We refer to it as cellular diaphragm. If you look here, this is to show you the dura. This is the fox cerebri. This is the tentorium cerebelli above the cerebrum. هنا بيجي السيريبرم وهذا الصغير هو الفوكس cerebelli, okay? You see it back here. This is the fox cerebri, which is separating between two cerebral hemispheres. This is the horizontal one here, is the tentorium cerebelli, which separates between what and what? شو فوقه بيكون? Cerebral hemisphere, below cerebellar hemisphere, okay? Between the cerebrum and the cerebellum. Tentorium cerebelli. And a smaller one here, you cannot say it, fox cerebelli. Separates between what and what? Two cerebellar hemispheres, okay? Between the two cerebellar hemispheres. Those are the main parts of the dura. Arachnoid matter, حكيت لكم عنها. It's thin intermediate layer that attaches the biomatter through a web-like trabeculae, branches, okay? That's why we call it the arachnoid. It's avascular layer. How it receives its nutrition? Filtration by the CSF, okay? And it holds against the dura by the pressure even of the CSF. This is important clinical note. هاي مهمة سريريا, okay? That the arachnoid is actually located in a space here, as you see it, against the dura home, the brown layer, by the pressure of CSF. فمعناته لما يقل ال CSF أو ينزل البرشر تبع ال CSF, هذا نسميه intracranial pressure, okay? When the intracranial pressure of CSF reduced, that means شو بيصير هنا? The arachnoid will separate from the dura matter. It will produce a space بين الديورا وبين الارachnoid. فهذا السبيس مش موجود عادة لأنه البرشر تبع CSF كافي إنه يضغط الارachnoid opposite to the dura. When this pressure is reduced, the dura will separate from, the arachnoid will separate down from the dura. So you will have a space. This space we refer to it as below what? Subdural space. And it is a pathological space. شو يعني pathological? يعني not present normally. Okay? It presents when we have a pathology. Okay? A disease. Pathology, science of disease. Okay? علم الأمراض. So when you have a pathology, you will have a lower intracranial pressure. The arachnoid will separate down, producing a space, subdural space. Okay? pathological. But if down to the arachnoid here, this is called a normal space. This is normal space. اللي هو شو سميناه؟ subarachnoid space. So the subarachnoid space is normal space. It has to be present normally. Why? To contain the CSF. Okay? Diameter, we spoke about it. Meningeal spaces. You see now, when we speak about the meninges, we have mainly three spaces we have to know between the meninges or within the meninges. Okay? Those would be the IBI. IBI, always remember this from now on in medicine. IBI means above. Okay? IBI means above. So epidural space above the dura. So it should be here. Okay? This space is also a pathological space. It's not present normally. It's usually between the dura and the bone. So some anatomists, again, to avoid confusion, will consider this space to be between the bone and the periosteum here as epidural space, because they consider this periosteum as part of dura mater. Other anatomists will say that epidural space is located here between the periosteum and the meningeal layer of the dura, because they say that periosteum is part of the bone, not of the meninges. Okay? So epidural space, it could be between the dura and the bone, where it could be between the periosteal layer and the bone, or between the meningeal and periosteal layer. This epidural space is not present normally. When it happens pathologically, when we have a hemorrhage, what's there in the epidural space or within the dura? Okay, you have, as I mentioned, meningeal arteries and large venous sinuses. So when you have a fracture in these bones of the skull, it will directly injure these blood vessels, leading to hemorrhage. This hemorrhage will lead to blood accumulation between the dura, the meningeal layer, and the bone. This blood accumulation will produce a space. We call it epidural space. It's the most common kind of injuries to meningeal arteries. Epidural hemorrhage, we refer to it as. Okay? So the epidural hemorrhage. The subdural space now is here. It is the space between what and what? The meningeal layer of dura and the arachnoid mater. It's not present normally, but you can find it when you have a lower intracranial pressure or a reduced pressure or amount of CSF. Okay? The subarachnoid space, the third one, this is it. Subarachnoid space is a real normal space filled usually with what? With CSF. So we have three different spaces. Above the dura, epidural space. Between the dura and arachnoid, subdural space below the dura. And below the arachnoid, subarachnoid space. Epidural hemorrhage. The most common kind of injuries because of a fracture of calvarian bones, okay, that will lead directly to injury of arteries and veins close to it, okay, to these bones, okay. And those are mainly meningeal arteries and venous sinuses, okay, which located within the two layers of the dura mater. So when the meningeal artery is injured, you will see that their blood will be accumulated between the bone and the meningeal layer of dura, as you see here. This yellow here is the meningeal dura mater, okay? So this will produce a pathological space. We call it epidural space. And this condition, we refer to it as epidural hemorrhage. So epidural hemorrhage, it means that there is an injury to a meningeal artery or vein, okay? Remember, this, not just artery, but because the artery is the more serious condition, okay? And the most common injury is the middle meningeal artery. More than 80% of epidural hemorrhage, أكثر من 80% من epidural hemorrhage بيصير due to injury to the middle meningeal artery in the area of the therion. Why middle meningeal artery? سببين. Middle meningeal artery هو the largest artery, okay, that supplies the meninges. Now when you look to the cranial bone, you will see that in the cranial cavity, إنه السكال بتتكون من 3 depressions, 3 fossae, okay? Anterior cranial fossa, البutterfly shape هاي شو اسمها؟ Middle cranial fossa, and this depression here is the posterior cranial fossa, okay? So we have anterior, middle, and posterior. المننجيال arteries اللي بتغذي المننجز هون بسميهم anterior meningeal arteries. The meningeal arteries supplying the bones and the meninges here, middle meningeal artery, وفي البوستيريور posterior meningeal arteries. أكبر meningeal artery is this one, the middle meningeal artery. اللي لو تتقطعوا هون شو هاي الفورامين اسمها؟ هاي اوفالي البيضاوية. Spinosum. If you look to foramen spinosum, you will see there is a groove in the bone. شايفينه هذا الأخدود اللي في البون اللي ماشي. هذا الأخدود بسبب إنه في artery داخل الفورامين spinosum وماشي هون ديب على البون بين البون وبين المننجيال layer of dura بين الديورا ماتر. Okay, this is a groove for the artery which we call it middle meningeal artery. Okay, so this is the middle meningeal artery. The largest meningeal artery is the middle meningeal artery. Okay, this is the first cause why 80% of dural hemorrhage there. Second most important cause is that it passes along the weakest point of the skull. Okay, هو بمر في weakest point of the skull. Where is the weakest point in the skull? You studied the axial skeleton. You know that in the skull we have an important regions: brygma, vertex, lambda, and therion. Okay, those very important intersections. The weakest point of them is the therion. Therion is this area. Therion is a Greek word which means therion. Therion is the weakest point in the skull, and it's usually located laterally. Okay, on the lateral aspect of the skull, 2 to 3 finger breadth above the zygomatic arch. لو تحط أصابعك على zygomatic arch, midpoint of the zygomatic arch, 2 to 3 fingers above, you will be in the area of the therion, which we looked at. It's made up of H-shaped suture. شايفينها؟ حرف ال H, السوتشرز عملات مع بعض حرف H. Okay? Mid of zygomatic arch, 2 to 3 fingers. You will be in the therion area. So any fracture or hit or blow, أي ضربة to the skull laterally, hone, it will lead to fracture here in this, okay, multiple suture area, in the H-shaped suture, which we call it the therion, the weakest point of the skull. شو اللي بمر على الثيريون مباشرة عامل أخدود عليها شايفين؟ Is the middle meningeal artery. Okay, so any blow to the skull will lead to what? To separation or fracture in the area of the therion. This will directly lead to injury to what? To the artery there, the whole middle meningeal artery. So that's why 80% of epidural hemorrhage is happened in the middle meningeal artery. Two causes. It's the largest artery, meningeal artery, and it's passing over the weakest point of the skull, which we call it the therion. Okay, the wing. Okay, the therion. Once it's injured, the blood will start to accumulate there between the bone and the dura mater. Okay. Once it's accumulating, blood عماله بتجمع, it will start to compress what? What is the softer tissue, the bone or the brain? The brain. So it will start to compress the brain. As it compresses the brain, the blood mass will increase. It will compress the brain tissue. As it compresses the brain, this will lead to what? To degeneration or to death, okay, of what? Of brain cells. By continuous pressure, at the end, if it's in the artery, within half an hour, this is an emergency situation. Within half an hour, the patient will lose his consciousness and get into a coma. Okay? If it's in a venous blood, okay, if it's in a meningeal vein, no, the process may usually last for weeks and even months. Okay? Because blood pressure in the vein is different from blood pressure in the artery. So that's why the injury, the epidural hemorrhage from arterial source is more dangerous and emergency situation. It's no comparison with an epidural hemorrhage from a venous source. Okay? Treatment, طبعا, draining the blood. You have to remove these fractures of the skull and to drain the blood out and to close the artery, ligate it. Okay? Moving to the next part, okay, which is the ventricular system of the brain. Similar to the heart. So we have chambers in the heart. في 4 chambers. The 10 small بسميهم atria, 2 large we call them ventricles, بطينات. Now the same in the brain. We have 4 chambers, 4 empty rooms. Okay, but all of them in this case I will call them ventricles. كلهم بطينات. ما في عندي atria. Okay, we have 4 chambers within the brain tissue. These are very important chambers because they are the areas or the chambers where the CSF is produced. اللي هو cerebrospinal fluid اللي حكينا عنه اللي بده يحفظ البرين والspinal cord, okay, in a fluid environment. So it's produced there within these chambers. 4 chambers, 2 large chambers located within each cerebral hemisphere. لو تطلعوا عليها فتحنا, this is a transverse section in the cerebrum في المخ. Okay, this is a sulcus, this is a gyrus as you see here. فبتشوفوا في 2 large chambers on each side of the midline within the cerebral hemispheres. في الرايت في واحدة وفي الليفت في another one. Those 2 large chambers we would call them lateral ventricles. Lateral ventricles because they are located laterally, each one in a specific hemisphere of the cerebrum. So we have a right ventricle, we call it right lateral ventricle, and we have a left one, we would call it the left lateral ventricle. Okay? So those we call them the lateral ventricles. Okay? The lateral ventricles, you see them here. This is one and this is the other one from the opposite side. So those are 2 chambers, first and second, lateral ventricles. وين موجودات؟ في cerebral hemispheres, في أعلى إشي في البرين. Okay? In the highest part of the brain. They will drain into a lower chamber, but this chamber is actually located now in the midline. Where? In the diencephalon. Didn't we study that? Diencephalon thalamus is located down to the cerebrum. So the 2 lateral ventricles will drain into a 3rd chamber or a 3rd ventricle located in the midline between the 2 thalami. We have a right and left thalamus. The chamber in between them, we would call it the 3rd ventricle, as you see. And here you can see a space. This is for interthalamic connection, if you remember I told you about, okay? Passing within the 3rd ventricle, okay? So this chamber within diencephalon, we would call it the 3rd chamber or the 3rd ventricle. Now the 3rd ventricle will connect through a duct passing in midbrain. شو اللي تحت الداينسيفالون؟ midbrain, صح؟ بعد الميدبرين hindbrain اللي هو 3 structures, pons, medulla and cerebellum. So in the cerebrum we have 2 lateral ventricles. They will drain into diencephalon. We have a 3rd ventricle. We call it 3rd ventricle. It's in the midline between the 2 thalami. Okay? Then تحت الداينسيفالون midbrain, there is no chamber in the midbrain. There is a duct that connects the 3rd ventricle to a 4th chamber. This duct within midbrain, we would call it cerebral aqueduct, which we spoke earlier about it. We said that this aqueous duct is separating midbrain into anterior cerebral peduncle and posterior dictum, if you still remember that. Okay? So this is called cerebral aqueduct. So there is no ventricle in the midbrain. There is only a duct carrying fluid, aqueous duct. We call it cerebral aqueduct. This aqueduct will go into hindbrain, pons, medulla and cerebellum, where it will dilated or draining into a 4th chamber. This will be called the 4th ventricle. The 4th ventricle where موجود في hindbrain. It is surrounded anterior superior by the bones, anterior inferior by the medulla, and posteriorly by cerebellum. Okay? So 4 chambers, remember this. 2 lateral ventricles within the cerebrum, they will open down into what? شايفينهم? They will open into a 3rd ventricle. A 3rd ventricle بروح لوين? I will show you a better. This is they are, how you see them. So those 2 in red are the lateral ventricles. The lateral ventricles drain into this chamber. This is the 3rd ventricle. 3rd ventricle when موجود? في الداينسيفالون, between the 2 thalami. There is a duct now connecting the 3rd to the 4th. This duct is called cerebral aqueduct. Where موجودة? في midbrain. You have to know each one where it is located. In the midbrain. Then down in the hindbrain you have this chamber اللي هي شو اسمها؟ 4th ventricle. Where is it? It's in the hindbrain. It's bounded anterior superior pons, anterior inferior medulla, وposteriorly كله الposterior surface بسميه الروف of the 4th ventricle اللي هو هذا. This is the roof اللي هو posterior surface or roof of the 4th ventricle اللي هو bounded by the cerebellum. بعدين من 4th ventricle a small canal will descend into the spinal cord as you see here. This is called now the central canal of the spinal cord. Okay? وكلهم هذول شو وظيفتهم عادة لغاية 4th ventricle? They produce CSF. So all of these chambers are filled with fluid. Filled with what? With the cerebrospinal fluid. So when we back here to them, اسمحوا لي, they are contain something called choroid plexus in each ventricle. في شيء اسمه choroid plexus. هذه هي اللي بتفرز السيريبروسباينال fluid. What is the choroid plexus? من اسمها chorion eidos. كلمتين إغريقيات. chorion eidos means choroid. Okay? Eidos means like, مثل. chorion membrane or skin. مثل الممبرين. It's like a membrane. Plexus is another word which means network. راح تسمعوا فيها كثير. plexus تشابك. network شبكة. Okay? So you have a plexus of what? Of membranes. This is the choroid plexus. It's different layers of membranes. Okay? That are responsible for producing the CSF. Okay? The CSF. So that is the choroid plexus. The choroid plexus is 3 layers or 3 membranes covering each other, okay, and functioning to produce CSF. How? Those 3 layers are made here as you see them, واحد, one in brown and the other one. What's happening there, when you look to the cerebral arteries, remember this, I told you we have meningeal arteries of cerebral arteries. Cerebral arteries وين موجودات حكينا؟ في sub-arachnoid space between the arachnoid matter and the biomatter. فلو تطلعوا this is the brain tissue. This black line شايفينه؟ هذا البلاك لاين هو البيوماتر. This is the biomatter, the 3rd layer of meninges. Okay? So the cerebral artery, okay, which provides blood supply to the brain tissue, will send a branch across the brain tissue. شايفينه؟ This is called choroidal artery اللي هو بتشوفوه هون. شايفينه بالأحمر هون؟ This is the choroidal artery. As the choroidal artery penetrates the brain tissue, it will take with it this black layer which is biomatter. بيمشي هو البيوماتر لحد ما يوصلوا الفنتريكل وبفوتوا على الفنتريكل. Once it gets inside the ventricle, you see here, this is a real image, and this structure here, شايفينه هذا؟ This is the choroid plexus. شوفوا مكبرها. The choroid plexus اللي هي عبارة عن ايش؟ شوفوا شكلها حتى جاي فيها زي ايش؟ انبوب artery ماشي. Okay? This choroid plexus is actually a small arteriole, or which we call it the choroidal artery. شايفينه؟ passing within the ventricle. لأن لما يدخل على الفنتريكل هون صار في بتكون من الارتري شو الوول تاعه في epithelial cell. simple squamous epithelium. بسميها endothelium. Okay? simple squamous endothelium لانها covering the blood. فمن بطن نسميها epi above, it's endo inside. ففي simple squamous cells هاي هم اول شيء اللي هم هذول الwall of the artery. Okay? wall of the blood capillary actually, not the artery itself. لانه الارتري بتعرفوا بيصغر بصير arteriole والارتريول بيصغر بصير blood capillary. Okay? So we have a blood capillary here with the covering cells around it. So this is the first membranous layer, the endothelial coverings of the blood capillaries. Okay? The second layer, they took it with them, is in brown here, the biomatter. Okay? The biomatter. The 3rd layer would be the cells, the endothelial cells covering, or the epithelial cells that covering what? The wall of the ventricle. Okay? ما هو هذه التشامبر في حيط محيط فيها بتكون من epithelial cells برضه. Okay? Wall of the ventricle is made of epithelial cells. These cells we refer to them as ependymal cells. Ependymal cells. Okay? So the ependymal cells or the epithelial cells covering the wall of the ventricle is the 3rd layer. فصار عندي هذا الكرويد plexus هو عبارة عن 3 layers. البلد كابيلاري نفسها ماشية okay with endothelial cells of its wall وحواليها covering البيوماتر وفوق البيوماتر شو فيه الابيثيليال cells of the ventricle. Okay? 3 membranous layers. Okay? This is the choroid plexus. Now what's happening here in the choroid plexus? The blood will pass through the blood capillary here. صح? Okay? As the blood passing, what are the components of the blood? Cells and the plasma fluid. The plasma fluid and the cells. The cells are RBCs, WBCs, white blood cells, and platelets, fragments of cells, platelets. Okay? Those RBCs, WBCs, platelets are very large, and they are covered here by 3 layers, 3 membranous layers, so they cannot pass into the ventricle. So they have to stuck within where? The blood capillary, okay? And return back into the venous circulation. However, the plasma fluid, the plasma of the blood is a fluid, okay, that can easily penetrate between the endothelial cells here, across the bile matter and across the ependymal cells or the epithelial lining of the ventricle to get into the ventricle. Once it penetrates now, it will be a clear, colorless fluid. This plasma fluid, which will filtrate, شايفين بترشح مثل الفلتر, across these three membranous layers from the blood into the ventricle, will now be called the CSF, the cerebrospinal fluid. Okay? So that's how cerebrospinal fluid is produced. It's not actually produced. It's actually the filtration of a plasma from blood across membranous layers into the ventricles. فهو نفسه البلازما fluid. And when this CSF is returning back now into the venous blood circulation, بيرجع ببطل اسمه CSF. شو بصير اسمه؟ plasma fluid. Okay? So the CSF is a filtration of a plasma from blood, okay, into these chambers. Okay? So that's how the CSF is produced. So now, when we speak about the ventricles, after the lecture, okay, we have two lateral ventricles حكينا. They are located where? شايفين? In the cerebrum, أعلى إشي. Those two lateral ventricles are very large cavities. They are very close to each other, by the way, as you see. They are just separated from each other, okay? They are separated from each other by a transparent membrane. لو تطلعوا في الريال برين حتشوفوا غشاء شفاف, okay? تشوفوا من خلاله. Very transparent. So this transparent membrane, we usually refer to it as septum pellucidum. Septum فاصل. Pellucidum transparent, شفاف. That's why we call it the septum pellucidum. And you can see it here. This area is the septum pellucidum, the transparent membrane. If I cut this membrane, I will go into a chamber, which is the lateral ventricle. This is the right would be lateral ventricle, okay? And you see that the septum pellucidum is located in the concavity of this white matter. This white matter is a very rigid structure, okay? هاي المنطقة شايفينها في الكونكافيتي تاعها في السبتم pellucidum. This white matter, شو يعني white matter? Myelinated axons. Those are bundles of myelinated axons that connect or associate the two cerebral hemispheres together. So we call them association neurons because they allow for association, for a better coordination between the right and the left cerebral hemispheres. فهم those are myelinated axons of interconnecting in between, interconnecting neurons. Okay? These myelinated axons or white matter area, they are forming a very rigid structure. هذا structure of white matter بيكون very rigid, صلب. Okay? And it is a myelinated axons of what? Of associated neurons. That's why they call this rigid structure of white matter as the corpus callosum. Corpus means body, جسد, the corpus. Okay? Callosum, hard, صلب, rigid. The rigid body, the hard body, because they are very rigid structure of white matter. Okay? We call it corpus callosum. فالcorpus callosum, within the concavity of it, you will see a transparent membrane. We call it septum pellucidum. This septum pellucidum is septing or separating between the two lateral ventricles. Okay? So when you look here, this is a lateral ventricle, this area here is the septum pellucidum. Okay? And part here, you see this white matter? شايفينها هون وهون? This white matter is part of what? Of the hard body, the corpus callosum. Okay? Or the hard body. The two ventricles now, شايفين فيهم ايش هاي سميناها؟ choroid plexus. شايفينها؟ Can you see the choroid plexus in the floor here of the lateral ventricles? Those lateral ventricles usually open in the midline into a third ventricle. Okay? This is called the third ventricle. How? Through a foramen called شايفينها? Ventricular foramen of Monroe. Okay? It's the interventricular foramen of Monroe. Foramen of Monroe referring to Alexander Monroe, Scottish anatomist and physician who described it for the first time. So this is the first connection. Lateral ventricle, هذول connections مهمات. هم اللي بيضبطوا لك الventricular system. You have 4 chambers, you need connections between them. So we have a first opening, okay, between the lateral ventricle and the third ventricle. It's called foramen of Monroe or interventricular foramen, okay? 2 foramina, right and left. They will drain the CSF from the lateral ventricles where? Into the third ventricle. Now the third ventricle, okay, as you see here, هاي المنطقة هون هو third ventricle. وهاي هون الاوبننج. This is the choroid plexus of the third ventricle. شايفينه؟ continuous هون مع الchoroid plexus of the lateral ventricle. فهون هاي المنطقة هي foramen of Monroe or interventricular foramen. لو تتخيلوها على 3 dimension, this is the chamber. It will drain through here into this chamber, third ventricle. The third ventricle will drain CSF across into the fourth ventricle through this canal, which we call it cerebral aqueduct. Cerebral aqueduct, which separates the midbrain into what? Cerebral peduncles and dictum. Okay? So the third ventricle will drain through cerebral aqueduct into this chamber now. This chamber would be what? The fourth ventricle. Now from the fourth ventricle, okay? So the third ventricle within the diencephalon, زي ما حكيت لكم, at the midline between 2 masses of thalamus or between the 2 thalami, okay? Its boundaries, lateral walls إله شو بدها تكون؟ شو lateral wall إله؟ زي هون شلنا السبتم بلوسيدم by the way. خليني هسه برجع لها. هون خلينا شوي. شو lateral wall اللي هو هذا؟ هون الشامبر. This is the chamber of third ventricle. What its lateral walls would be? This structure. شو هذا؟ thalamus. Its lateral walls is or are the thalamus. Okay? So the thalamus is the lateral wall. The floor is hypothalamus. Okay? The floor is hypothalamus. It communicates with the fourth ventricle عبر هاي الدكت. شو سميناها؟ cerebral aqueduct. Okay?